Okay, this is a quick audio review of health and wealth. So, difference in wealth, difference in health. So, first, America's health rankings are embarrassing. We are far down the list for life expectancy. Babies born in the US have lower birth rates and less healthy outcomes than kids born in countries like El Salvador or Cuba, right? Cuba, that's under embargo, has better health outcomes than the United States. But these averages do not show the real picture because there are large discrepancies in the country, as a person can be born in this country with half the life expectancy as another, not due to health issues at birth, but due to social distances that arise from social inequality, right? And so this provides very different health outcomes when you look at race, class, and gender. So there's some interrelated causes here, meaning, poverty, inequality, and the way we structure healthcare systems really have a lot to do with why we see such stark inequality. So if we focus on improving these issues, we can improve the health outcomes of millions of Americans. And the sad thing is, this isn't just a concern for the most marginal. This is actually a concern for the majority of the population, right? When you combine the poor and the middle class, that's overwhelming majority of the population, right? So even middle class parents worry about the next medical emergency. So as a health emergency can bankrupt any middle class family in America. Even checkups, though, and copays and prescription costs, those things are expensive and hard to manage. So even if you have money, even if you have a good job that provides health insurance, it's not free. It is difficult to navigate these systems, right? Also, people stay at jobs, right, or fear leaving their job, trying to go to different jobs or maybe a career field that they're more passionate about because they need health insurance. And so most Americans get that health insurance from their employer. So they can't quit. They can't go on strike. They can't, advocate for, better conditions for themselves. Why? Because they're contingent upon that employer for health insurance. And so what happens if they're laid off? What happens if they don't have access? What happens if, they get out of line and lose that job? It's not just their health. It's often their spouse's health, their children's health that gets, that becomes a problem. And again, that's just for people who, again, are already in the middle class, have much more power and privilege. So this is, tenfold for poor people, especially that just can't gain access. Or if they do have, Medicaid or other services like that, there's only certain places that'll take you. There's still going to be certain things you're going to have to pay for out of pocket. And so this makes it very difficult for people to navigate these systems. So it's interesting. When we talk about health and wealth, we have to talk about the structure of our healthcare system, meaning our system is set up as a system of profit. So what I'm going to do is, I usually show like a big chunk of a film during this lecture. So since I can't do that in this audio lecture because copyright stuff, if I put it up on YouTube, what I'm going to do is clip together a MP4 version of what I would normally show you in class and put that up for you as well for this week. So please also watch that video because it's clips from the film Sicko, right? Michael Moore's amazing documentary Sicko that talks about how the healthcare system was formed itself. Why was it formed this way? Well, spoiler, it was Nixon. It was actually there was always a financial incentive to setting up this HMO program, right? Also, the way that he looks at in the film, how do other systems around the world provide coverage to their citizens? He finds that they do it at a fraction of the price, and they do it by providing free healthcare, right? So they pay a fraction of the price we pay per person here in the U.S., have better health outcomes, and have these universal systems. So meaning they're like single payer systems. They either come out of tax dollars or other kind of structural ways. And so as a result, then everyone has access, right? So the taxation and the structure of the healthcare system around the world is very different than ours. And it's also something we can learn from, right? When we think about how, we learn a lot of stuff from a lot of countries in other ways. Like he actually makes a really great point about that in the film Sicko. Like he talks about at the very end of the film in a beautiful little speech that I'm not going to put in the clip. He basically says how, when there's a good wine from another country, we drink it. When they make a better car, we drive it. Like, why is it that we just won't adopt a universal healthcare system? like a Medicare for all or any other version of this, a single payer system, because that's literally the standard across the world. And especially when it comes to developed first world countries like the United States, every other developed nation that's similar to the US, especially European nations, all have universal health care of some form or another. So they might not cover everything, or they might be a little bit different in the way that they are instituted. But the idea is those other countries, their government provides that universal health care, and oftentimes housing and childcare allowances, pensions, tax credits, these things that dramatically improve the lives of people in their countries and actually alleviate some of the social distance that comes from social inequality, right? And when it comes to outcomes for health. So another difference is that the government invests in education in order to have more skilled workforce, meaning in the US we used to do this, right? And this is why we had innovations in a lot of things and the kind of, craftsmanship, American craftsmanship, right? But when you think of Germany, right, or us back in the day, it's kind of interesting. Germany never stopped investing in education. When we did after the 1970s, we stopped investing in education. And what's interesting is that's when other countries have kind of leapfrogged over us since the late 1970s when it comes to, car manufacturing, or Germany making parts for the iPhone, things like that they are on the cusp of these technological advances, not us, because we don't have the skilled workforce, right? Because if you don't pay for people to all get college trained, then people aren't going to have access to more advanced programs, then you're going to have less educated workforce, right? So most importantly, though, they actually tax rich people in those countries, right? So that means that college is available to everyone who wants it. Childcare is affordable, right? There are some housing assistance programs. And universal healthcare is there so that people can use healthcare when they need it, not just in dire emergencies, which again, we know in our capitalistic healthcare system actually causes everyone else's health insurance premiums to go up, right? So the most important thing is in other countries, they tax rich people. That's something that we forgot that we can do. It's a thing, but it's become so controversial here. But it shouldn't be like that, right? That's not how it should work. Like Robert Reich, great dude. You should totally follow him on Twitter. He's fire on Twitter. He's the best. But he's basically a former, I'm trying to think of, he was like the secretary of the economy or something of that nature when in the Clinton administration, the first 4 years of the Clinton administration, he basically resigned after that because they weren't taking a lot of his suggestions really seriously. And actually what's interesting is when he was labor secretary, that it was actually, the best economic time period of turnaround, largely because of the way he looked at these structural policies. He was looking at other countries and saying, hey, look what they do, right? And so he really talks about how we still don't tax the rich. We don't understand how we're creating an unequal system that makes it worse and worse each year. So meaning that tax plan that Trump put into place, I think the first year of his presidency, I believe, it basically went from 30 companies not paying any taxes, when you're talking transnational corporations that make billions of dollars a year, to 60 companies not paying taxes. So Amazon itself got a $148 million refund in 2019 when they earned, almost $12 billion in profit? So it's completely insane, meaning, if a worker's making, $50,000, $45,000, they're paying 30% of their income in taxes. You have someone like Jeff Bezos or, that owns Amazon, or really Amazon, the company itself, paying $0 in taxes, but actually getting a $148 million refund is obscene, right? So it's criminal. It's really straight up should be criminal, right? So what happens when you give all that money to billionaires? Nothing, right? They keep it. They don't invest it back in the system. That money never comes back into the system. So it doesn't help us create better health outcomes. And the fascinating thing was, Elizabeth Warren, when she was running for president, she put out this wealth tax plan where she basically said, you can make your $100 million or whatever it is, but then she wanted to put 2-cent tax on, people making more than that. For every dollar they made more than that, 2 cents of it would come out. which again, you're talking about people that can, like Scrooge McDuck, dive into chambers filled with gold coins, right? We're not talking about they're going to be like really feeling any of this 2 cents. But she basically planned from that 2 cent tax of, these billionaires in our country that you would be able to fund universal health care, free college, free college for everyone, a debt relief program for people that have student loans, and free childcare services and universal pre-K, which is, yeah. I mean, obviously, when you think about what in the short term and really in the long term would dramatically impact the lives of poor people. Healthcare, childcare, education, all of these things. We know that social mobility comes from having more stability in the culture, right? If you're not having to work 3 jobs to put a roof over that head, right? If you're able to make more of an income because now your employer isn't paying for your healthcare, so they can afford to make your wage a lot higher, right? Or if we look at countries that provide these services, like in the clip from, the film Sicko, he talks to these people living in France and how, their average work week's like 30 hours a week. Why? Because they're so much more productive than we are. They're much happier, right? They have mandatory 6-week paid vacation every year, even if you're a part-time employee, right? And that, they talked about having unlimited sick days because they're like, well, if you're sick, you're sick. You got to take care of yourself. There's obviously it's a capitalistic society, but it doesn't have such a profit motive invested in it that it denies the health and safety of people, right? So obviously it's not as if those countries have no inequalities. But the idea is when we look at these indexes of, child mortality rates, we see that in our country, it's horrifying that depending on your race, depending on your class, and the specific region in which you're born, you can basically predict the life expectancy of someone. So that if you're born in one part of the country, you have half the life expectancy as someone born somewhere else in the country, right? So a kid born in Detroit versus born in Beverly Hills, right? And so that's obviously a failure of the system itself, not a failure of that individual person's health outcomes, right? So we can create a more just system. And actually what's fascinating to me is that, Bernie Sanders and bringing a lot of these arguments about Medicare for all to kind of the public domain has really changed people's perceptions of it. So when he ran in 2016, it was considered extreme. And then now, after running through the 2020 season, actually it's fascinating. Most polls find that the majority of conservatives or Republicans favor a Medicare for all system, meaning most people realize, hey, even if I get my health care from my employer, my neighbor doesn't, my cousin doesn't, my whatever doesn't. Like, even if I have good health care, that doesn't mean other people do. And I should also care about their health and safety, especially in the context of the global pandemic and things like that. We've really seen how other people's health also affects our health, right? In a very pressing way. And so it's really interesting when we look at this and we say, why are we in the situation we're in? How could America deal with the pandemic in such a terrible, poorly organized way? Well, look at the structure of the system. Look who's in charge. Look who benefits. Look who financially benefits from the system as it is, right? Then you'll see the roots of what's wrong and how you can then structure some sort of resolve, right? But if we're in a system where we give billionaires more money because they're billionaires, right, but don't actually have an organized system to provide healthcare for, millions of Americans who need it, then obviously we're going to have huge catastrophic consequences when any sort of, real advanced health issue occurs, such as a pandemic, right? So again, please, I implore you, I'll put up that clip for you as well, to watch the MP4 of the film Sicko. I'm just going to put up a couple little clips to really look at this stuff more in depth. And I know the films, it should be out there somewhere. I mean, you can probably see parts of it on YouTube, but I don't want to get a copyright infringement, so I'm going to put that up as a separate file for you guys as well.